Hello and welcome to Culture Vultures. I'm Sandy Frye, your host. Our creative director is Nancy Cole, and this is a program that examines arts and culture around the Bay Area. You know, anyone who is involved in the arts and enjoys the arts knows that arts can do a lot more than just entertain. Think about the protest pop songs during the Vietnam War in the 60s. Or think about the graffiti artists who were just dismissed until they came up against some really beautiful art, wonderful art by graffiti artist Keith Haring. And then there was, very recently, a great majority of Americans who felt that transgendered, lesbian, and homosexuals didn't necessarily have to enjoy the prerogatives and privileges of American citizens. And that's changed too. But now we have another kind of art that is both inventive and artistic and effective. It's the way in what arts can touch lives. They can help in the health care of children and adults. The arts in health is an experience that will come to Tampa Bay and is being organized right now by two arts therapists that are our guests today, who are beginning the initiative with the help of the Arts Council of Hillsborough County. Heather Spooner, you are now the director of this initiative, and Dana, you have had tremendous experience in creative care, and you've worked from New York to Tampa, and with Shands in between, I think. And you've had experience in this whole phenomenon. First, why don't you just try to give a capsule feeling for what this program can do?
Sure. I teach art therapy at the University of Tampa, and in that position have really met a lot of great programs in the community, in part because we put out so many interns. And it happened that I started receiving a lot of contacts from different organizations, hospitals in the area that were really interested in having arts programming. They were wondering about arts therapists, volunteers, artists in residence, both how they can set up those programs and how they could find people that would be very good to work with them. And it was amazing to me that I knew so many people doing this work in the community who were practiced and had lots of experience, who would love to hear about these opportunities and weren't finding them. And so I approached the Arts Council. I had known Lynn Norton there for several years, and I asked her if this was something the Arts Council may be interested in being involved with. And it happened that it was the perfect time for them to take on a new program, and Lynn was very excited about it. And so that was the very beginnings that we started meeting and talking about what this program would look like, and it became Arts for Health Tampa Bay.
I was very surprised and interested to learn that the UT has a nursing program, and there has been a kind of an arts and program integrated with it. And Dr. Susan Taylor Lennon, I think it is, of the dance department, was one of the people who also joined in the initiative. And UT, in fact, did a little kickoff, not a little one. A substantial one.
We did, and it's funny because that's housed in three very different programs. The nursing department has Julia Riley. She's a nurse artist, and she teaches a program there. They also have the undergraduate art therapy program, and then Susan Taylor Lennon is a very experienced artist in residence in dance. And so the three of us have really been brought together strongly by this initiative too, even though we were working in very separate departments.
Now, there have been programs in place in various places in the United States, and certainly in Florida. I think Shands and Moffitt have had programs for a number of years. And I know you have worked in one or both of them.
Well, I was an intern in Shands. That was a number of years ago, around 10 years ago. And then there's a program under the umbrella of Creative Clay. It's called Creative Care, and it's their arts and healthcare program. And they've been in existence since 2008, the Creative Care program under Creative Clay. And they...
and is that literal? Do they work with clay?
No. It is definitely more figurative. However, Creative Care goes into the local area hospitals in St. Pete. And they've had various funding streams, including a large grant from Allegheny and from the National Endowment for the Arts.
And from the national, well, that's good.
Yes.
That gives a certain heft to the whole thing, just as the Arts Council support does too.
Definitely.
And I think that you have now affected a relationship with Sarasota Manatees.
Yes, they had their own coalition that was there for several years, and it actually, in part, they were some of our inspiration for starting the one here locally, and so it was natural for us to reach out and start communicating to one another. And we really realized part of what we're trying to do is bring people together and start communicating more regularly, and we thought, how ideal would it be for us to go ahead and join with them as well. So now if you find us, we're under the umbrella Arts for Health Florida, and within that there's 2 divisions, Arts for Health Tampa Bay, and they have since changed their name to Arts for Health Sarasota Manatee.
Oh, good. When you have the arts, you're speaking about visual arts, music, dance,
Drama,
creative
writing.
and creative writing. Oh, that's wonderful. Now you have had courses and obviously substantial background in them. How do you begin? I have to say that there are 2 symposia. That one has taken place in March, one is going to take place in April. And one of the things that was shown was a very short film which really struck me. It showed a group of 5 people, 3 women and looked like hospital scrubs, sort of blue, and 2 men with white shirts. And they were tossing volleyballs around. And the men would toss it mostly to each other, and the girls would toss around and to the men. And the audience was asked to find out how many times the male threw it to another male, and then that other male threw it back. And so everybody is very deeply watching it, and it's maybe a minute, and it's done. And the MC said, all right, how many? And the numbers were all over the place, 4, 11. And it was 15. And then it was asked, did anyone see the gorilla? And when everybody looked at each other and said, what gorilla? He replayed it. And by golly, there was a gorilla who just briefly ran in and ran around the circle and ran out again. And the moral is that when you're told to concentrate on something, you might have missed the big thing. And how can you prepare for that? What kind of exercises would you go through, or do you just learn to listen intently?
Yeah, that video is a great video, great illustration. That was actually Jill Sankey presented that. She is the head over UF's Arts and Medicine program and also the assistant director, I believe, at Shan's Arts and Medicine program. And she was in particular talking about with pain, although arts are used for all sorts of things, and showing how when someone's really engaged, really focused on something, how it's so easy to overlook some of the other things. And in that particular instance, I think she was comparing that gorilla in the room to perhaps the pain, the anxiety, some of those other things that people experience in the hospital.
Right.
And so part of what the artists in residence do, they're coming in and bringing very engaging arts activities for adults and for children both, and helping them to have some time to really focus on something else and engage in that so they can forget momentarily at least everything else that they're experiencing.
Well, for the therapist, it can work in reverse too. If you just concentrate on one thing, you might miss another sort of entree to how to treat the pain in a child or in an adult or whatever. But that's a very good example. She also, although we don't have it here, had a very moving film about a young woman who had been suffering from sickle cell anemia for a long time, and it's a terrible disease with no cure in sight at this point, and it can rack people. And this young woman was resistant at first to the idea of doing anything else but bearing it. And then through music, she was able to delve into herself and forget about the pain, which is a very hard thing to do, I think, with pain that intense. It was a marvelous thing, and she never left the bed. This isn't something that she jumped out of bed and began to dance around. It was going into herself, and I think that's probably, I think if you're well, you have a problem going into yourself if you have to. But to do that in the face of pain and then be able to release it is, it's a triumph for you. It's a triumph for the therapy, I think. Are there many affiliates, by the way, in Florida? I know there are many, many national, international, and state associations, but how about Florida?
Yeah, part of what we're trying to do, and actually Dana was involved with us when we started setting this all up and part of the committee, and you worded it so well talking about silos. There were all these silos throughout the state, these individual programs that were doing this for years, but didn't necessarily communicate or reach out to one another. Right. And you mentioned a few. Moffitt's been here for a long time, Shands, and I think Creative Care that you were involved with in some ways was even a bit of a silo. And so what we're trying to do now is to go ahead and reach out and have a way for them to communicate, share practices, right. Job opportunities, training, some of that, and to collaborate on some of those resources.
So that's the way the this initiative will operate then. It both will get artists who are skilled at this and hospitals or other centers that need artists. Are there any preparatory courses or anything that would be helpful for an artist who had no previous experience?
Well, I think it's important just to mention that at least one of my thoughts of what this group is really about bringing these various players to the table. So there's artists who possibly are hoping to become artists in residence within the hospital setting. There's creative arts therapists. There's arts administrators. There's museums. There's healthcare staff. There's healthcare administrators, all with an interest in this work. And so really part of this initiative is about bringing everyone to the table.
Right. Well, is the result that you see simply relieving the patients of pain, or is there are there other outcomes? For example, and I ask this because hospitals, being what they are, they have tremendous expenses, and if you can give them another reason besides the well-being of the patient, I think they would be glad to have that.
And there's all kinds of wonderful outcomes that can come of this, and I'll let you elaborate on that in a second. But it's interesting when you bring up the hospitals and obviously their bottom line. One of the really interesting studies that was brought up at the last symposium came out of Florida State. And what they did was they were looking at different types of medical procedures that children were going for. And they found that when they had a music therapist who accompanied the kids for those procedures, they were able to do the procedures without using anesthesia or sedation.
Wow.
And so they were saving costs on the sedation, they were saving costs on not having to have an RN present. Some of their techs were there for a shorter period of time. And the music therapist's salary was actually very low. So for the course of this study that they did, I believe it was $77 per patient that they were able to save. And for the 92 people involved with the study, it saved the hospital $7,000.
That's amazing.
Yes.
And that's a very good, significant reason.
So there are some selling points for the hospital as well, but going back for all the other benefits for the patients.
Yes, it makes great financial sense. The State of the Field report that was written by the Society for Arts and Healthcare, which is now the Global Alliance for Arts and Health. They changed their name recently. So back in 2009, they did this large study, and they talked about all the benefits of having arts within healthcare settings, including reduced healthcare costs, increased patient satisfaction, family satisfaction, and staff satisfaction. In a place where healthcare, especially in the news lately, so fraught with tension, this is a really, it makes sense.
It does, and that reminds me about Obamacare. I don't know that it is totally in place and everything is enunciated, but that it may be some, provide some means of carrying forward this initiative, not within this county and its surrounding affiliates, but throughout the United States. It strikes me that if you can do this with children who can really not be aware of the fact that they aren't being anesthetized. And I imagine that, number one, they have taken care of some after effects that might be harmful to the children. But secondly, in countries that don't have the kinds of facilities that the United States have, this is in place of, because there are no anesthetics. I have ARB.
It's a tricky word
with that
Yes.
one. Yeah. Someone give me an anesthetic. But, well, how do they interact with you in the hospitals? Well, how does the process go?
Do you want to speak some about creative care first? 'Cause
Sure.
they've been practicing for a while.
Sure. So I will use the example of All Children's Hospital. It's where the creative care artists were through the National Endowment for the Arts grant. So we went through Child Life. That was our main entree into the hospital. They provided direct oversight while the artists were at the hospital, as well as they provided the referrals and some of that initial training of what you do when you walk into a unit, how you clean the various materials, because that's imperative that there be some strict guidelines around materials that are used. So Child Life was an amazing resource, and I think it's important to have someone within the hospital setting that is advocating for this work, because they're familiar with the culture of that particular hospital.
Sure.
And so these artists, you asked a little bit about training before, what is necessary. So these artists not only are extremely talented in their particular field, so painting, drawing, dancing, creative writing, but they've also gone through some pretty extensive training in how to navigate healthcare systems, as well as they had weekly artist rounds where they provided one another with artist-to-artist supervision, and then a supervisor, the coordinator was also there. And not only did they have that training, but then they had hospital training.
I imagine that's very important.
Very important. Yeah. So there's a lot to this. So I know a lot of people would love just to transition from maybe some studio work into the hospital, but there's a lot of steps in between.
Right.
Yeah.
How many institutions are training people in Florida, or even in Central Florida? I think that's probably where you have most of your experience.
Again, I think it comes down to those silos. There's some great individual programs that work with just a few artists.
Are they part of a university that you're speaking, or standalone?
I was thinking about standalone, like creative care. There are a few
standalone.
programs. I know there's a couple of art therapy programs. UF has an arts and medicine, arts and health program. I don't know the exact title of that. Sarasota has a certificate program. And they're all slightly different. They're training artists to do slightly different things. They do slightly different work. But what we're trying to do informally without a degree here is to go ahead and give them an opportunity, at least for continued education.
Sure.
Whether that comes from interacting with each other, or we will also be offering symposia, as you mentioned already. But a lot of people are already trained from their educational background. They've had years of experience in the hospitals. And so this is an opportunity for them to go ahead and find those opportunities, and also maybe for people who are just starting out and want some information to start to get involved and maybe get some volunteer experience or learn from the experience of others.
Either or both of you of the opinion that you learn a lot through actual experience?
Of
And
course, yes.
Yeah. And can you think of any particular, either very satisfying experiences or something where you learned something else about what a technique that either does work or doesn't work? How about you?
I have an example, and I want to just make the distinction between an artist in residence and a creative arts therapist.
Okay.
Because I think it's important.
Yeah.
So, and I will share an example with you from when I was an artist in residence. So this was before I was trained as a therapist.
Okay.
So an artist in residence is an artist, and they then have additional training in order to go into a healthcare setting.
Okay.
A creative arts therapist is either an art therapist, a music therapist, a dance therapist, a drama therapist, or even a poetry therapist, or an expressive arts therapist. So there's all these distinctions, and they all have different credentialing credentials and training.
Right.
So artists in residence aren't doing therapy, but they are bringing art into the hospital setting, which in and of itself can be therapeutic. And that's the example I'd like to give.
Are artists in residence more usually seen with working with adults?
Both.
Both. Okay.
The example I'm going to give is I was actually an intern at Shands, interning as an artist in residence, and I would bring a sort of bag of goodies because I never knew who I was going to meet or what they were going to be interested in. So I had some clay in there, and I had paint and oil pastels and some movement scarves, all again cleaned according to hospital protocols. And I met this little girl, and basically I think about a week prior, she had to be rushed to the hospital. She was from out of the country, actually, and she was rushed to this hospital because she had a rare form of cancer. And within a few hours, they had to make the decision of whether to amputate her leg, and they did. And so when I went in there and I started to share with her some of the things we could do, she immediately gravitated towards the clay, and she started sculpting this very intricate rose. And she would ask some advice on which tools to use and that sort of thing. And then she titled it Rosebud. And she shared with me later that was what the name she had given her leg. She said, I actually think it's kind of beautiful. It looks like a rosebud.
Oh, nice.
Yes.
Really?
And again, artist is assisting with the creative process, the sculpting. A therapist would delve into more, how does that make you feel? Maybe doing some assessment.
Right.
We then later, I brought out some movement scarves, and we began very gently starting to use them. First, she did it from behind her sheet. She used that, and then she came out and really began to use the movement scarves. And we, after about 30 minutes with some music, we choreographed this entire piece that we then shared with her mom. And later she shared with me, she goes, I used to be on the dance team. So I didn't realize how important this dance was for her, that she could still dance even without her, her one leg. So again, a therapist would probably take that in a whole different direction, but as an artist, we could just choreograph a piece and show her mom.
Right.
So.
Oh, well, that's very good. And because it sounds like learning in every direction possible. And but mostly how really positive most kids are.
So resilient.
Very resilient.
Yes.
And it occurred to me too, as I was thinking about this, is that the advances in medicine these days mean that children with rare forms of disease have a better chance to survive it, but it also means they are in the hospital more. And that means that, I mean, there's just so long a 4-year-old or a 6-year-old or even, you know, a 10-year-old can go to bed alone at night, you know, and think about this, and just the presence of another person who understands and is working with that child can make a significant difference, I know. I was telling Heather that I once saw a television program about children going to various hospitals with very bad conditions, and one boy had a very, very virulent form of cancer. And whereas other kids were beginning to respond to their therapy, he wasn't. And it affected not only him, but his mother. She was the only one who visited him, and then she stopped visiting. Either she couldn't bear it, or she didn't really understand what it would do to him, you know. And he came in cocky and just strutting around, and you saw the light just finally go out of his eyes, you know, and because he finally just felt abandoned, I think. And if there had been anyone there, it might have been a different story, at least, and not necessarily for a complete cure. Just that this person deserved to have that kind of thing. So good for you guys. I think that's great. Well, what else is from here on in? Do you begin? How do you gather your artists? Are you do you do you have like a bulletin board, or how do you rate? I mean, how do you, I guess, understand what their strengths are, and where would they be most likely to be effective?
Sure. We started first by reaching out to the artists that we already knew about that were doing this kind of work. So Creative Care, I know you've established a great group of artists who've been working. Moffitt has a great group of artists. I'm involved with the Florida Art Therapy Association, so tapping into some of those creative arts therapists. We've also reached out to music and dance therapists as well. Okay. So spreading the word through those channels first, and then we ask them to join with us in one of two ways. We have a supporting membership, which is really for people that are just really interested in this work, or perhaps want to get involved, learn more, and maybe have some volunteer opportunities. And then we also are just rolling out this month a professional membership. And that professional membership, we're asking for people to have a couple of years of experience, but that experience can be any combination of their educational background, volunteer experience, or paid work experience. Okay. And so we do ask them to give us an application showing they have some of that background. So again, when we set up this database and we're offering it to organizations and saying these people have this background, they can come on and see exactly where they've worked and what they've done in the past.
Very good. Well, I imagine fundraising is going to be an important part of your initiative, and for good reason. I mean, these are very wonderful children that you're going to be working with, and it's not something that you can do casually. I'll say that. Believe it or not, we're almost done with the program, and I'd like to just first thank you, and second to just say that across the street in Moffitt Cancer Center, and facing the Cancer Center is a research center, and the halls leading to the auditorium there have the work of an artist, a young woman who at age 25 came to USF to do graduate work, and found that within a month she had been diagnosed with Hodgkin's lymphoma. And she had to go through a very, very arduous therapy. And she decided to make art which reflected what she was going through. And to begin with, she would be making short scratches and sort of with a diagonal across, and it reminded me of those World War II movies where prisoners of war were always marking off the weeks. But then, when she began to do it a little bit more intimately, they became big and they looked like damaged earth. And by the way, her therapy was good. She got her degree, she got married, and she's now expecting a child, which is just wonderful. Her name is Megan Hildebrand, and her art is right now at the Research Center. And she cured herself in one way. Well, it's been great to be with you, and plan to join us again.